Thanks for listening. And this is part of a couple of screencasts or podcasts that I'm recording prior to the workshop we're doing on patellofemoral pain at La Trobe University in July. And this is not medical advice on its own, but it's meant to be podcasts to supply with knowledge on basic things related to patellofemoral pain prior to us meeting at La Trobe. And my name is Michael Rathleff, and I work as a senior researcher for the research unit for general practice here in Aalborg, Denmark. And even though Aalborg is the third largest city here in Denmark, it's still quite small. And just to give you an idea of where Denmark is, I've put in a map, and on the map of Denmark you can see that Aalborg is up here in the northern part of the mainland called Jylland. But enough about geography. And the question I want to explore in this screencast is a bit about the epidemiology of patellofemoral pain. How common is it, and in which population are we most likely to meet patients or individuals with patellofemoral pain? And importantly, what kind of impact does patellofemoral pain have on life? And as I mentioned, this is part of a series of screencasts, and I know that at least 4 of these pre-recorded screencasts will be made publicly available before the workshop. So even though you can't participate in the workshop, we'll try to make some of the material open access to everybody. One of the common patients that I met previously in my more clinically oriented career was someone like this. Anna, 16 years of age, and she loves to play basketball. She plays 4 to 5 times per week, and she would enjoy having a competition during the weekends. And she met me after a period of on and off knee pain, and then suddenly she couldn't really participate at that level she wanted to be at. She had patellofemoral pain, but she didn't contact me until her knee pain was so bad that she couldn't perform on court. And that was basically the reason why she came to me. But is Anna the only one, or is there other girls, young girls, boys on her team that would also be affected by patellofemoral pain? That's the question. And to answer the question of how common patellofemoral pain is, we can also ask the question, well, how common is musculoskeletal complaints overall, and does it really affect how many years we live with disability? One of the major efforts into documenting the impact of musculoskeletal complaints overall is from the Global Burden of Disease Studies. And they've done an amazing amount of work to assemble knowledge from everywhere around the world, and then afterward doing a systematic analysis. So if you look at this graph of leading causes for years lived with disability, we can actually see that number 10, that's musculoskeletal complaints. But if we look into the top of these leading causes, we can see that both low back pain, that's number 1, neck pain, number 4, and then on the 10th we have other musculoskeletal complaints. So the point I'm trying to make here is just musculoskeletal complaints is a huge cause of years lived with disability. And it's not only in the adult population. Here we have one of the graphs that's specific to the UK population. And if you look up on the far right corner in green, you can see that there's a green box and it says musculoskeletal disorders. And then if you look down on the x-axis, you can see the years. How old are the participants? And here if you look at age group 5 to 9, the green box is quite small. There's only a few years lived with disability because of musculoskeletal disorders. But as soon as we reach 10 to 14 years of age, we can see there's a huge jump, maybe 4 or 5 times as many years lived with disability. And then At 15 to 19, we see a doubling as well. So somewhere around these teenage years, we see a huge increase in years lived with disability because of musculoskeletal disorders. And it's not only among the adult population. You can see there's a massive green spot from around 20 years of age and all the way through to above 80 years. But it starts in the early teenage years, it appears. And this is quite consistent with our own data. So we've done a number of studies on both really young adolescents between 10 and 14 and also the age group between 15 and 19 years of age. And this is from a study we published in the British Journal of Sports Medicine a while back on the effect of exercise therapy in adolescents with patellofemoral pain. Among these 15 to 19-year-olds, we asked them, when did your knee pain actually start? And based on that, we could see that the majority actually reported that their knee pain started somewhere around the age of 10 to 14. That fits quite well with this sudden increase we can see in the years lived with disability in the previous graph. The typical patient that I would see, and also those that are kind of the cases reported in the literature, is that it seems to affect a lot of young people. And then they often report this insidious onset of anterior knee pain. They can't really pinpoint the exact location or time point when they started to experience knee pain. It's just something that gradually got worse at the time where it might affect their sport participation, or they could not bicycle to school or to work or something like that. And they often report this diffuse pain on the anterior part of the knee every time they load up their knee during stair walking, bicycling, and things where they load with a flexed knee. And they rarely report knee pain at rest, but there are some in our data, 10 to 15%, who also have a bit of knee pain at rest, but that's mostly common after they've participated in sport. And when you talk to these patients, you quite quickly get an idea that patellofemoral pain actually has an impact on their quality of life. And we can also see in our data that it has an effect on how physically active they are. So basically, patellofemoral pain, even though it affects the knee, it actually affects the entire individual, their choices in life, and also how well they're feeling. And the diffuse pain that they feel is rather different between the individual patients. We've been trying to look at all the different pain patterns that these patients might experience. This is from a study that's in review at the moment, where we used a Navigate Pain, which is a tablet, and we asked adolescents, both young and a bit older adolescents, on how to draw in where they experience their knee pain. And this is just a few examples from the studies. And what you can see is that it's really, really different between the different patients. So all these have a clinical diagnosis of patellofemoral pain. So even though they have the same diagnosis, so to speak, it's really, really different where they feel their pain. Most of them have peripatellar pain around the patella, and some of them will also have retropatellar pain. But what you can see is that it's not really well localized. It's most often quite diffuse. So returning to one of the original questions, how common is patellofemoral pain both in the general population but also in these sport-specific populations? We did a study a while back here in Aalborg in Denmark, where we tried to examine the prevalence of knee pain in general, but also see how common is patellofemoral pain compared to other types of knee pain. What we did was we sent out an online questionnaire to 2,200 adolescents between 15 and 19 years of age. And all those that reported knee pain, that was basically 1 out of every 3, we then telephoned them and asked them, where did you actually feel your pain? Did it start after a trauma, or was it a non-insidious or an insidious onset of pain? And then if they reported anterior knee pain or pain on the anterior part of their knee, we invited them into an examination where we had 3 rheumatologists to diagnose all the different adolescents coming in. And basically what we found was that 7% of all the adolescents were actually affected by patellofemoral pain. So that was 7% of the general adolescent population, which makes patellofemoral pain one of the most common knee conditions with an insidious onset among the adolescent population. There's also other studies, for example, from Timothy Hewitt's group, Meyer et al. 2010, where they looked specifically at female basketball players, where they found out that 9.4% actually developed patellofemoral pain during the course of a season. The same finding from Barbara Foss, where they also looked into high school and middle school and found a prevalence around 7%. And our data, we did 2 studies, actually one where we found a prevalence of 7% and another smaller study on 227 adolescents from 15 to 19 as well, where we found a prevalence on 5.7%. So collectively, the prevalence of patellofemoral pain is quite high. And the 2 studies we've done on population-based studies, where we can see a prevalence around 6 to 7%, while the prevalence does appear to be a bit higher in the sports populations. And I think that makes perfect sense, because patellofemoral pain, that's associated with some kind of overload of the knee joint. And that's often done during sports. So that could account for the higher prevalence in the populations that participate in sport, but more on that later. Then if we look into the adult literature, there's quite a few studies on military populations. And one of the most famous ones is from Thijs in 2007, where he followed military recruits in Belgium during the first 6 weeks of basic training. And this is where they have a huge increase in training load during a very, very short period of time. And he actually found that 43% developed patellofemoral pain. So of course this would be some kind of a acute patellofemoral pain they developed. And then a few years later, bowling in the military in the States saw that among 1,600 in naval recruits, I think it was, 3% developed patellofemoral pain during the course of their basic training. So quite a bit lower compared to the Belgium study, but still highlighting that patellofemoral pain is also common among recruits in the States. And Eric Rudrow back in 2000 made one of the first studies that actually investigated the prevalence among university students. So these were young, I remember around 19 or 20. And he followed these 300 university students during the course of a couple of years. And 8.5% actually developed patellofemoral pain during this time. So again, highlighting that patellofemoral pain, quite common. Another famous study that actually showed the clinical burden, or not burden, but how common it is in clinical practice, was Taunton, where he found out that 16.5% of the clientele was actually diagnosed with patellofemoral pain. So the main point is that patellofemoral pain is quite common in participants or individuals who participate in sports. And to no one's surprise, we can see in our own data and also in other populations that patellofemoral pain is twice as common among females compared to males. And the reason why I bring out this slide is to highlight the 2 different populations of participants with, or individuals with, patellofemoral pain. We've discussed the that patellofemoral pain is so common or quite common in sports participation or sports populations, but what we can also see in our own data that originate from a population-based cohort is that around 1/3, somewhere between maybe 20% or 30%, don't participate in sport at all. And I find this so fascinating because previously I was quite sure that patellofemoral pain was almost non-existent in the more sedentary populations. But here we can really see that around 1/3 don't do any sports at all. And when I talked to this was young adolescents, but they're the kind of adolescents who never done any sports whatsoever. And then suddenly when they maybe go from one high school to another where they have to bicycle, or come to a new high school where there's stairs, that seems to be enough to maybe create some kind of overuse injury, patellofemoral pain, similar to the young boy or the grown-up who participates in sports 5 times per week. This is quite fascinating, I think, because we need to tailor our treatment. Maybe we don't need to apply the same type of treatment to one that participates in sports 5 times per week compared to the sedentary one that never do any sport at all. And this is something I think we should discuss and expand upon on the workshop. How can we tailor treatment? Meaning, how can we tailor exercises? How can we tailor patient education to fit the individual in front of us? The other data I have on this slide is just that the worst pain last week, around 50 millimeters, a bit higher for females. And a common finding is also lower or low quality of life. In this case, we've used EuroQual 5 dimensions a few times. Others have used quality of life. The finding is similar across the different quality of life scales. And furthermore, in our case, we've often seen they have quite a long symptom duration. In one of our studies, we actually saw that in the population-based cohort, the symptom duration was around 3 years, which is quite long considering their young age. So just to highlight, because we mentioned that it was common in sports populations, but it also exists outside of sports populations. So if the individual in front of you is sedentary, she or he might as well be affected by patellofemoral pain. So the question is, why do so many individuals develop patellofemoral pain? It's a beautiful question, and there's been 5, 6, 7 really nice prospective studies that try to investigate why do these people or individuals develop patellofemoral pain. They've developed or found that there's some risk factors that are associated with the hip, meaning how you move, but also how strong you are. And the same goes for the knee. They found the stronger you are, the less likely you are to develop patellofemoral pain. And also how you move after a drop jump. And then we have some risk factors that are associated with the foot, both how you load the foot, but also your navicular drop, meaning that if you have a larger navicular drop, it appears to be more likely that you will develop patellofemoral pain. But what I think is a key message is that none of these risk factors are really, really strong risk factors. It's nothing like smoking and lung cancer. On their own, these different risk factors are quite small. So even though they see an association between this risk factor and developing patellofemoral pain, it's not like you can look at the individual in front of you, measure strength, and then say, yes, you will develop patellofemoral pain, or no, you won't develop patellofemoral pain. These are small risk factors. But maybe there are things that are even more important than your strength and your biomechanics. Maybe it's more about training load. Maybe it's more about load versus capacity to handle load. And these are some of the things that we want to expand upon at the workshop, because I think this whole concept of training load, risk of developing patellofemoral pain also ties in really nicely on patient education, what we need to talk to the patients about when they come see us because of knee pain. And expanding a bit on the impact of patellofemoral pain, and we've used previously different kinds of questionnaires to assess the impact of patellofemoral pain on pain, symptoms, ADL, sport recreation, quality of life. And this is the KOOS, the knee injury and osteoarthritis outcome score. And if you look at the blue bar, this is adolescents with patellofemoral pain. We've also used it on adults with patellofemoral pain. They score quite similar to the adolescents with patellofemoral pain. So they score quite low and significantly lower than the green bar on top, where it's older adults or young people without knee pain. But still, if you compare them to meniscal lesions, they score a bit lower, 5, 8, 9 points lower, those who actually have a meniscal lesion. And then if you look into older adults, 65 plus with knee OA, they score even lower. But the reason why I put in the KOOS scores from older adults with knee osteoarthritis is just to put in the perspective of patellofemoral pain, because looking at this graph, you can really see that the participants, individuals with patellofemoral pain, score quite low on these 5 constructs: pain, symptoms, ADL, sport, recreation, and quality of life. So yes, patellofemoral pain impacts on life. So while the previous slide showed that patellofemoral pain have an impact at the moment they have patellofemoral pain, we've also been interested in what's their prognosis? Does patellofemoral pain go away on its own, or what is their prognosis? So this is from a study where we followed 153 adolescents with patellofemoral pain and 350 who had other types of knee pain. We followed them for 2 years, and then we asked them if they still had knee pain at follow-up after 2 years, defined as weekly knee pain. And what we found was that 65% of the adolescents between 15 and 19 still had knee pain even 2 years later. And among the group with other types of knee pain, it was quotation, only 50%. So based on these findings from our large prospective cohort study, it appears that adolescents with patellofemoral pain have a 25% higher risk of having knee pain after 2 years compared to other types of knee pain. And I think this is really, really important, because when you talk to other professionals, they might view patellofemoral pain as something benign, self-limiting. And based on these data that clearly shows that 65% still have knee pain after 2 years, kind of suggest otherwise. Only 35% deems themselves as recovered and pain-free after 2 years. And furthermore, in the group of adolescents with patellofemoral pain, 71% actually stopped or reduced their sports participation during this 2-year period. And that was significantly more than adolescents with other types of knee pain. And this really also suggests that patellofemoral pain have an impact on how much or how physically active you are. This ties into all these health concerns. So if you have patellofemoral pain, it appears that you're also more likely to have pain 2 years down the road, but also you're likely to stop participating in sports. And this clearly underlines that we need to be really effective in treating adolescents and adults with patellofemoral pain and learning them how to self-manage, because this is not something that will go away on its own in a few weeks. The same goes for the adult population. This is a really nice study from Nat Collins and colleagues. They combined the data from a really large Australian RCT and a large Dutch RCT. I think this prognostic paper included, 310 patients together. And what they saw was that after 12 months, 40% of participants had an unfavorable recovery. And the most consistent prognostic factor was the knee pain duration. So if they've had knee pain duration above 2 months, then they were more likely to have an unfavorable outcome. I think this is important because if we can start to pinpoint the different prognostic factors, we might be able to tailor treatment to them. And we'll talk more about this at the workshop. So the last couple of slides showed that a large proportion of both adolescents and adults will actually have an unfavorable recovery after having been diagnosed with patellofemoral pain. But the question is, does patellofemoral pain lead to patellofemoral osteoarthritis? At the moment, we don't know. There's no good prospective studies that can confirm the association between patellofemoral pain and patellofemoral osteoarthritis. But we do have a few retrospective studies that suggest that long-standing adolescent knee pain might increase the risk of early patellofemoral osteoarthritis. But it's important to highlight these retrospective studies can be highly influenced by different kinds of bias. So there's no way that we can yet confirm this. So I hope this short screencast on epidemiology, prognosis and impact of patellofemoral pain has sparked your interest in this area. And here's some further questions that you can use to reflect on before we meet, if we meet at the La Trobe workshop. And I hope you enjoyed this. And once again, thanks for listening. Bye.